Our next speaker is unfortunately not able to be with us in person today because she's not well, but fortunately she has been able to record her presentation for us. So our next speaker is Shelley Fuld Nasso, who's speaking about advocating for better survivorship care. Shelley has a Master's of Public Policy and she's CEO of the National Coalition for Cancer Survivorship, where she advocates to transform the cancer care system for everyone touched by cancer. NCCS engages in public policy efforts to improve cancer care and empowers cancer survivors and caregivers to be a voice in public policy debates. Prior to joining NCCS in 2013, she led public policy efforts at the Susan G. Komen Breast Cancer Foundation. She's a graduate of Rice University and Harvard Kennedy School, and she advocates in honor of her dear friend, Brent Whitworth, a beloved physician who died at only 43 from cancer. So we are very grateful to Shelley for recording her presentation, which we will now watch.
Hi, my name is Shelley Fuld Nasso, and I'm the CEO of the National Coalition for Cancer Survivorship. I was really hoping to be there with you today. I've been looking forward to this for a long time and being able to see some of my favorite champions for cancer survivorship. But unfortunately, I woke up this morning and took a COVID test and it was positive. So I thought I just had a summer cold, but I unfortunately have COVID. So I'm recording this presentation and I'm just very sad not to be there with you all. But I really wanted to share with you, I know you've heard today from some amazing experts about survivorship care and research and the field of survivorship overall. And of course, you have lived it in your survivorship from Hodgkin's lymphoma. And so what I'm going to talk to you a little bit about is what we do at NCCS to try to improve survivorship care and how you can help us and work with us. So let me share my slides. So the National Coalition for Cancer Survivorship represents the 18 million cancer survivors who share this experience of living with, through, and beyond a cancer diagnosis. So in 1986, a group of cancer survivors convened, including Susie Lay, who's there with you today, with a vision to create a nationwide awareness of cancer survivorship, a concept that really didn't exist in the scientific literature. And they changed the lexicon of what it meant to be a person with cancer from victim to survivor and really launched the survivorship movement. One of the early things they did was to develop the imperatives for quality cancer care, which helped lead to the creation of the Office of Cancer Survivorship at the National Cancer Institute. And you heard from Emily Tonarizos today, who is an incredible leader of that office, and we love to work with her. And she's deeply committed to improving cancer survivorship. So when those founders got together, they decided that they would define survivor from the time of diagnosis through the balance of life, and later expanded that definition to include family, friends, and caregivers. So our mission is to advocate for quality cancer care for everyone touched by cancer. And the way we do that is to educate and empower cancer survivors to advocate for themselves, to train and support cancer survivors and their caregivers to advocate for better care in their communities. We provide data and resources for healthcare professionals on the challenges faced by survivors. And then we advocate at the national level for public policies that address the needs of cancer survivors. One of the sources of data that I mentioned is our State of Survivorship Survey. Last year in 2023 was our 5th year to do this survey, and we will be conducting another survey this year. And if you, later I'll give you information about how to connect with us. If you connect with NCCS, you'll get an email inviting you to participate in the survey. And we're working with Emily's team at the NCI to write a paper on the findings from our survey. We ask questions. The survey includes in-depth interviews to kind of help us frame the questions. And then we have a nationwide survey of 1,300 cancer survivors and 500 caregivers. We set quotas in that national sample to ensure that it's representative by age, gender, race, ethnicity, types of cancer, et cetera. Because we want to make sure that that sample really represents who has cancer in this country. So it's 50% men and women, and it's a little over half are people age 65 and over and on Medicare. We also recruit what we call our NCCS connected sample, and those are the people who found us. So they are either actively involved with us as advocates, or they happen to follow us on Facebook and just got an email about the survey. But either way, they are a little bit different than that national sample in terms of their engagement and empowerment in their involvement in their care and in their satisfaction with their care. Those are the two biggest differences we see each year when we compare that national sample and the NCCS connected sample. The survey has a ton of data in it, and I'm not going to go over all of it. A lot of it is going to be very familiar to you, things that you've lived in your experience. But what I really wanted to share was, this is the kind of the breakdown of the national sample compared with the NCCS sample. The NCCS group is skews higher women, younger, higher education, higher income, more private employer insurance as opposed to Medicare or Medicaid. So I'm just going to share a few of the slides, and you can get all of the survey report data on our website, which is canceradvocacy.org. But when we look at satisfaction with care, we ask about satisfaction from kind of all the different phases of the cancer journey, from screening, diagnosis, treatment, decision-making, treatment, coordination of care, and post-treatment care. And we've found year over year, people are very satisfied in general. But we also find that they're less satisfied with the post-treatment care than they are with treatment itself. One thing that was interesting that we ask a lot of the same questions of the patients and the caregivers, and that way we can compare kind of the difference in the mindset and decision-making. And we find that the caregivers are much more interested in being engaged in decision-making and much less satisfied with their care. Overall, the patients are satisfied with their care because they're happy to be alive and grateful for the team that helped them through. And I think of the caregivers as a kind of more of the truth teller that, is grateful that their loved one is alive, but also saw the challenges along the way through their treatment. So you can see overall that the caregivers were significantly less satisfied with their care than the patients themselves. And again, they're less satisfied with the post-treatment care than they are with the treatment itself. And we also asked people if they received a care plan, and about 80% of people said they received a care plan. We didn't specifically ask what that care plan looks like, and so that's something we're going to follow up on this year and ask a little bit more detail about what the care plan looked like. Was it a discussion where they felt like they made a plan and talked through their options, or was it a written plan that outlined what the treatment would look like? But what we did see is the people who said they had a care plan had higher satisfaction with their care. So that's a positive. Now, this care plan, we didn't specify a survivorship care plan, and that's something we're going to ask in this year's survey. We've asked before and found that less than 20% said they received a survivorship care plan. This one, we didn't specify it, whether it was a survivorship care plan or more of a treatment care plan. And so I think that's part of why we got that higher number of 80% saying that they received it. So we also ask about their experiences with the healthcare team, and whether, including, how often they felt like they could talk to their healthcare providers about any concerns they have, how often they felt listened to, whether they completely trust their healthcare team. And we did see some differences by race and ethnicity in terms of trust levels and feeling like that they could talk about their concerns. But the other thing that on this slide shows is about 70% said that their healthcare providers coordinated well with one another. But then we also asked, how often did you have to share information from one healthcare provider to another? And, over 50% said either all or some of the time they're sharing information. I know that that's not the only measure of care coordination, but I do worry that the burden of care coordination is placed on the patient, and some patients aren't as able to do that and need that support. And so to me, care that where you're the one burdened with sharing that information is not as well coordinated as it could be. And then here again, the caregivers were less likely to say the care was coordinated, and more likely to say they had to share information, and also had less, lower ratings in terms of the kind of rapport and trust with the healthcare team. We asked about side effects, and we asked about 20 25 different side effects. These were the top 15 that were shown. And you can see here anything in blue means it's statistically significantly higher. So for women, they experienced a lot of these side effects at a higher rate than men did, with the exception of sexual concerns. Red is statistically significantly lower. But I think what's also important here is we ask if you experience these side effects during treatment, then we also ask if you're still experiencing them. And then we also asked it, like, we kind of compared that by how far out from treatment they are and whether they're still experiencing these side effects. And so for certain ones, like the top ones of the fatigue, the depression, anxiety, even many years later, people are still experiencing those side effects. And then about 60%, 62% said they felt very informed about potential side effects from treatment. 31% said somewhat informed. The NCCS connected patients were less likely to say that they were very informed. And then we asked for those same top 15 symptoms that people said they experienced. We asked how helpful the healthcare team was in addressing those. And, you can see for most of these, it's less than half said that the healthcare team was very helpful in addressing these. We see higher ratings for things like nausea and vomiting, skin irritation and rashes, high blood pressure, things that we know how to treat through medicine. But some of the things where it's harder to treat and harder to help people with, like fatigue, depression, loss of appetite, those are the ones where not as many people are feeling like they're getting that support from their healthcare team. But again, those who had a care plan are more likely to say that the healthcare team was very helpful. And then we also ask about their post-treatment experiences. We asked, who's the primary healthcare provider managing your post-treatment care? So about 30% said that it was their primary care physician, and 44% said their oncologist. And then we ask about, and then 22% said others, and that can include a variety of different types of professionals: surgeon, dermatologist, endocrinologist, et cetera. So it depends on the type of cancer and other conditions that people have. But we ask about, what do you talk about in your post-treatment visits? And overwhelmingly, the focus is on follow-up tests to monitor cancer. And we also asked, what do you want to talk about in those meetings? And even though patients talk about having high levels of concern about things like exercise and nutrition, quality of life, mental and emotional impacts, physical function, they're still okay with talking about the follow-up tests. So it's like these post-treatment visits are really just focused on the scans and the tests, and not the quality of life issues that, even though people are describing these quality of life issues, they're not talking about it in these appointments, and they're kind of okay with that. And that's concerning to us, because we want people to know that they can ask for help with these things, and we want them to be able to find someone who will help them with the concerns that they have, and that the post-treatment survivorship shouldn't just be about those follow-up tests. So now I'm going to talk a little bit more about what NCCS does, but you can get the rest of the survey results on our website at canceradvocacy.org/survey. You can download the full report, and there's a webinar where we release the report, and there's graphics and a lot of information there about the survey. I only covered a very small portion of it because I wanted to share some other things with you. So our Cancer Policy and Advocacy Team is our advocate engagement program. If you scan this QR code, you'll go to a link where you can sign up for it. It's free to sign up, and you'll get on our mailing list to get information about everything that we do. Erin is a member and has been for a long time, and is a wonderful advocate. We're so grateful to have the opportunity to work with her. One of the things that we do is a symposium in Washington, D.C. in June. So it's coming up in a few weeks, and Erin will be there, and she's been a number of years. We do a couple of days of training, and we have a Hill Day where we go meet with members of Congress and talk about legislation. We also have a virtual symposium later in the year, like in September, for people who can't travel to DC for the in-person symposium, but really for anybody who wants to join. It's not really limited to people who can't travel. And it's about a 3-hour symposium where we talk about a few different topics. We do webinars throughout the year to talk about policy issues, advocacy best practices, issues of concern for survivors like health-related issues. We have an email newsletter update that once a month with advocacy opportunities, and we have a closed Facebook group where we also post advocacy opportunities. So this is Veronica Paniotu, who is a 10-year survivor of Hodgkin's lymphoma, and she is our advocacy and programs manager. She was a CPAT member for a number of years before she joined the staff to manage the program. And what she likes to do is really kind of get to know all of our advocates so that we can match you with engagement opportunities. So sometimes we'll get a media request that they're looking for somebody who's had a certain experience, whether it be denial of health insurance for a certain procedure, or having a certain type of cancer or a certain type of treatment. And the more we know about our advocates' experiences, the more we can match them with these opportunities. Also, research advocacy, we get researchers coming to us looking for an advocate to be involved in a project that they're doing, to serve on an advisory committee. We nominate advocates to participate in research review through the Department of Defense. Sometimes there are speaking opportunities, or maybe partners that have patient advisory boards or marketing campaigns. And we try to be the facilitator and match when somebody comes to us looking for that patient voice, and match them with the patients in our CPAT network. And these are just a couple examples of some of the webinars we've done this year, including Michael Stubblefield, who you've heard from today, who's wonderful. We love partnering with Dr. Stubblefield and the team at Revital to try to make sure that more cancer survivors know about rehabilitation. It's something that's out there and available to them. Unfortunately, in our survey, when we ask about the different types of providers people have seen, only about 5% say they saw a rehabilitation specialist or physical therapy. And so our goal is working with Dr. Stubblefield and others to try to increase that number. So these are just a couple of examples, but we do a number of webinars throughout the year. Elevating Survivorship is another program that we have where we work with a cohort of advocates from around the country. We have an application process to become an Elevate ambassador, and we provide mentoring and support and training to the Elevate ambassadors to work on their projects. And Erin Cummings was in our very first cohort of Elevate ambassadors in 2019, I believe it was. And when she came to us, I thought, well, she's already doing so much amazing work. Why does she need to be part of Elevate? But it was incredible working with her. And she has said that her participating in Elevate has helped her improve the work that Hodgkin's International is doing. And that's why I was so excited to come to this conference. I'm very, very sad that I'm not there with you all today, but I'm with you in spirit. But these are just some examples of this current year's, our current group of Elevate ambassadors working on different projects. Some are advocates working in their communities, like Yvonne Florence developed resource centers in community churches in the Philadelphia area where she lives. And some actually work in healthcare institutions. So Lori Christensen works for a cancer center and the survivorship program. And she knew that one of the things they needed to do better was to develop some educational materials about sexual health after cancer treatment for survivors, which is something that comes up in our survey as an important need. So these are just a few examples. If you join CPAT and connect with us, you'll learn about when we open up applications again, and we will probably be doing that this fall for the next group of Elevate ambassadors to start next year. We ask in the application process that you come with an idea for a project that you want to work on in your community to improve survivorship. And community can be a physical community, whether it be your local area or your church or your cancer center, or it can be a virtual community like Hodgkin's International, where you connect survivors virtually around the world. And these were just a few more examples of some of the Elevate projects that have happened over the last few years. I think we're on our 4th cohort of Elevate ambassadors, and again, we'll be choosing some more to work with next year. Kimberly Richardson was in the first class along with Erin, and she really she came in with 1 or 2 ideas and ended up after the training with 6 ideas, and she implemented all of the programs, and actually out of her experience founded an organization called the Black Cancer Collaborative, and has just done an incredible, amazing work with her efforts to improve survivorship for cancer survivors in her community, which is in Chicago, and working with and include Black cancer survivors in research And she's just, like Erin, another amazing success story of participating in the Elevate program. So now I'm going to talk a little bit about some of the policy work that we do. There's two pieces of legislation that we're going to be focusing on this year when our advocates go to the Hill in a few weeks. The first is the Comprehensive Cancer Survivorship Act, which is bipartisan legislation introduced by this group of members of Congress. Brian Fitzpatrick is our Republican co-sponsor in the House. Which is great. We only have Democrats in the Senate, but we're trying to find a Republican because cancer should not be a partisan issue, and it touches everyone. So we always try to work with members of both parties. So we'll talk about what the legislation does. It's really, it's called the Comprehensive Cancer Survivorship Act because it really does try to address the health of cancer survivors throughout the continuum of care from diagnosis through treatment and post-treatment, and to close some of the gaps that survivors face. So this is a list of kind of everything that's in it, and there's a lot there. And what we try to focus on, a couple of the provisions that we think are very important, but because it's a lot to talk about if you're going to meet with members of Congress and talk about it. So we focus on a few provisions, one of which is comprehensive cancer care planning, which I'm going to talk about in a moment, but also things like an alternative payment model. So when we had a prep call and Erin and a number of others were talking about why isn't there more of this survivorship care being delivered? And one of the reasons is it's not, the payment isn't there for it. Unfortunately, it's the payment is for a regular office visit, which is not reimbursed as well as things like procedures or giving chemotherapy or other things that are kind of higher value to the healthcare system than just those, the office visits where you have time with your healthcare provider to talk about what's going on and what you need help with and how they can diagnose issues you're having or guide you to what you need to do about it. And so we think that a payment model that incentivizes better survivorship care would help make sure that it happens. So that's one of the things that we've been working on. Also, patient navigation, and assistance for people who are trying to maintain employment while they're going through a cancer diagnosis, an adult survivorship study, which I'm going to talk about in a moment, and then some other provisions related to children with cancer and Medicaid coverage of fertility preservation. So there's a lot there, and when we educate our advocates to go to the Hill, we just talk really about two provisions to make it manageable. So cancer care planning and communication, what this would do is create a Medicare service and payment for care planning and coordination to help improve that coordination and then also that transition to primary care after after treatment concludes. So cancer care planning has been identified as an element of quality cancer care by the Institute of Medicine and in a number of reports. In a few years ago in our survey, we asked if people received a survivorship care plan. It was less than 20% who did at the conclusion of treatment. We're going to ask that question again in the survey this year. But without a written plan, survivors are left to navigate their cancer diagnosis without clear direction. And so the cancer care planning service in Medicare would really just provide that reimbursement for physicians to do this. It would also help them. A lot of times it's a nurse behind the scenes who's creating the plan, and that time isn't covered, isn't paid for. So the time with the doctor face-to-face with the patient is paid for, but not necessarily that behind the scenes time. And so we think that having this as a specific service in Medicare will promote them doing this and having better decision-making, empowering patients with the information that they need to manage and coordinate their care. So the other provision that we're going to be talking about when we go to Capitol Hill is this adult survivorship study. And there's a number of ways this could be done, but what we really want to see, there's a really very successful childhood cancer survivor study that's been done over many years that really tracks childhood cancer survivors as they continue throughout their life. And we don't have very good systematic long-term data about the effects of cancer treatment on people like you all who've lived with Hodgkin's lymphoma and had long survivorship with many, many side effects. We know about it through you all gathering and talking with each other, but we don't have that long-term systematic data, and we would like to see that. So that is one provision here, is to really model an adult survivorship study to follow people long-term, like we have done for childhood cancer survivors. And so when we did ask about some of the symptoms that I showed you in our survey, whereas 74% were still experiencing symptoms if they were diagnosed 3 to 5 years ago, but if people diagnosed 10 plus years ago, more than half still experiencing symptoms today. So that's why we think that more systematic tracking of the effects of the cancer treatment would be really helpful to improving survivorship care, improving the quality of life of long-term cancer survivors. So the other piece of legislation we're going to be talking about is a Cancer Care Planning and Communications Act. And this is really just exactly the same as the cancer care planning that's in the Comprehensive Cancer Survivorship Act, but it's in its own separate bill. So Congressman DeSaulnier is a cancer survivor. He has CLL and is going to be in treatment for the rest of his life. He's really dedicated to cancer survivors. We've worked with him for a number of years, and he's had a bill focused on care planning for a long time. When Congresswoman Wasserman Schultz, who's also a cancer survivor, wanted to create the Comprehensive Cancer Survivorship Act, she asked him, could I include that cancer care planning in my legislation? And he said yes, and so they worked together on it. He's a co-sponsor of that, but he also wanted to introduce its own bill. Some of this is just about the way Congress works, and also one of the things that Congress looks at when they're thinking about legislation is how much is it going to cost. This standalone provision just for cancer care planning would cost a lot less than the whole big bill of the Comprehensive Cancer Survivorship Act. So we kind of feel like we need to attack it in both ways. So we are for both of these. This is really the same thing that is in the other bill, but we want to get co-sponsors for both. So when we go to Capitol Hill, we talk to members of Congress about it and ask them to become a co-sponsor. That just means that they sign on to say that, yes, I agree with this. I would support this bill if it came to the House floor for a vote. And so the more co-sponsors you get, the more likely you are to have movement of a bill. They have, many thousands of pieces of legislation introduced every 2-year session of Congress, and most of them don't get enacted. But the more co-sponsors you get, the more likely you are to have any kind of movement on it. So that's why having your members of Congress say, yes, I want to be a co-sponsor is a good signal that this is something that a lot of people support. And if you can get bipartisan support, even better. So that's why we go to Capitol Hill and talk to Congress about it. And you all, even though you can't come to this year's symposium because it's too late, but we would love for you to sign up to be members of CPAT and come next year to DC. But you can still talk to your members of Congress about these pieces of legislation. They will spend the majority of the month of August in their districts or their state. All members of the House of Representatives, if they're running for re-election, will be campaigning. And about a third of the Senate will be up for re-election. And so they'll be campaigning as well. But they do take a big recess in August. And so they're home and you can go meet with their district office, or you can just call their office and talk to them about it, or call and try to schedule a Zoom meeting. So you don't have to come to DC to advocate for these pieces of legislation. And there's tons of information on our website about how to do that. And we're here to support you if you want to talk about these pieces of legislation with your elected officials and you need help, we can help you with that. Another program we have is Survivorship Champions, which is really geared towards clinicians and researchers trying to improve survivorship care. And we do a number of webinars, but the webinars are also really popular among advocates because the topics are just really amazing. This webinar from January was on making the mouth-body connection in cancer care, talking about a lot of oral health issues during cancer treatment and after. And the other webinar is about making integrative oncology regular and routine. Again, they're geared towards healthcare professionals, but I get a lot out of them. I think you might as well. And all of the webinars are available to view on our website. We also have lots of resources on our website for survivors. We have a page with a lot of information on integrative oncology, including videos from people talking about different integrative oncology modalities and how it can be helpful. We also have a page on cancer rehabilitation with Dr. Stubblefield and some of his team members, as well as some patients and advocates talking about how cancer rehabilitation was helpful to them. And then we also have these resources on our website. We have some checklists. There's a cancer survivorship checklist. We have different versions. We have one for when you're in treatment, when you finish treatment, if you're living with advanced and metastatic cancer. And we are completing and will soon have on our website ones for young adult cancer survivors and for head and neck cancer survivors. And then if you want to connect with us, you can go to our website. You can sign up to be on our newsletter email list, the Healthcare Roundup. We send that out once a month with policy news and updates. But really what you probably want to do is sign up to be a CPAT member. And again, it's free and you'll get updates from us on everything that we're doing and how you can get involved. So thank you very much. Thank you, Erin, for organizing this incredible conference. I'm so sorry I can't be there. And I would have loved to have been there to honor the amazing Susie Lay. I know she'll be getting an award tonight, and she is a role model to me and has inspired me in my work with NCCS. And I wish I could be there, but Susie, I love you. Congratulations. Congratulations, Erin, on an amazing conference. And thank you all very much.